And welcome back. I'm Mabel Jong. You're watching live coverage of the World Healthcare Congress coming to you from Washington, D.C. I'm Mabel Jong. Thanks so much for joining us. In the studio right now, Alison Croke, who is Vice President of Medicaid-Medicare Integration, Neighborhood Health Plan of Rhode Island. Hi there, Alison. How are you?
Hi, Mabel. Very good, thank you.
Have a very unique duals demonstration going on in your state right now. Can you give us an explanation of what that is?
Sure. The duals demonstration in Rhode Island, which is the federal program in Rhode Island, our brand name is the Integrated Care Initiative. It really started in 2012, where the governor of our state authorized the Executive Office of Health and Human Services to pursue federal authorities to bring the Medicare and the Medicaid programs together in a more coordinated way. The opportunity to do that really came about through the Affordable Care Act, where these duals demonstrations were offered as really innovative approaches to bring those two programs together. So Rhode Island went out to bid in 2 phases for their duals demonstration, starting with managed long-term services and supports, and then moving into the full demonstration where Medicare and Medicaid are combined and integrated. So that launched in 2013 with our managed long-term care product at Neighborhood, and then moved into the full duals demonstration in July of 2016.
So approximately how many people are affected by this demonstration?
In Rhode Island, there's a little over 30,000 individuals who are considered dually eligible for Medicare and Medicaid. At Neighborhood, we have about 24,000 of those 30,000 enrolled in either our duals demonstration program or our managed long-term care program.
And what have you learned from when the program first started to now?
We've learned a lot in the last several years. We've learned a lot about who the duals are, what their chronic conditions are, what their social issues are. We also have learned a lot about the providers that take care of those individuals on a daily basis. We work a lot with nursing homes, with home care providers, assisted living facilities, adult day centers, providers that really serve individuals that are elderly and disabled, some of whom we knew before working with this population, some of whom we didn't know very well, and the unique challenges that industry faces. We've learned a lot about that.
So have you had to incorporate social determinants of health in your work now that you know some of these cases very well?
Yes, every single day, social determinants is a focus of the work of our integrated care teams. Our integrated care teams consist of nurses, social workers, as well as rehab specialists, helping people, say, we're living at home alone to make sure they don't fall, they don't have carpets and other furniture in the way that could contribute to falls. We also have individuals that we call community outreach specialists, sometimes referred to as community health workers. So those are paraprofessionals that are trained to help people with those social issues. Housing is a major issue. In our state, we have an older housing stock in Rhode Island and New England in general. So finding affordable and accessible housing is a major issue, and sometimes is a barrier and leads people to need to live in nursing homes.
And so how have you been able to address it with the resources that you have?
Our community health workers, as well as our nurses and social workers, partner very closely with all the housing authorities in the different cities, in the core cities in Rhode Island, and have had some success securing vouchers for individuals, as well as helping people find other alternatives to housing, maybe living with family, living with friends. We're always interested in the housing being affordable and accessible, but also safe.
How is this demonstration different from what you've done in the state in the past?
Neighborhood has a long history working with the state as a Medicaid managed care organization. Neighborhood started in 1994. So we've been a Medicaid managed care plan for almost 25 years, receiving high quality reviews from NCQA and other organizations. This population is different because they have Medicare, and so Neighborhood has only recently has become really a Medicare-Medicaid plan, an MMP. Up until that point, Medicaid was really our core business, and so with the duals population, we've expanded that business into working more on the Medicare program as well.
I've heard about some of the challenges you've outlined, but what about the successes?
So we've had successes in trying to address some of the core issues as to why people have to go to a nursing home. We've partnered with a lot of the providers in our community, for example, assisted living facilities who want to be able to offer an alternative to nursing home care. Most recently, we're piloting a new level of assisted living that we call dementia level assisted living. So for individuals with cognitive issues or dementia, often the nursing home is really the only option for them because it's not safe for them to live at home with their family any longer. These assisted living providers that we've partnered with are now offering a level of care that hasn't been offered in the past. So we're starting off small, making sure that it's a program that works for us and for the providers and for the members. So we've been partnering with providers to offer some innovative clinical programs as well as social programs.
And what do those look like?
In addition to the assisted living dementia level, for example, we've also partnered with a community-based provider to put in place some caregiver supports. One of the leading causes as to why people enter into a nursing home is because the caregiver, maybe the spouse, maybe the sibling, maybe it's a daughter or son taking care of that person every day or helping with that person every day, is just burned out. They have their own life, maybe their own kids, maybe a job. So what we've done is partner with a community-based provider to offer some caregiver supports, some 24/7 advice, 24/7 RN access, and using technology, leveraging smartphones and other types of devices with a secure app where they can communicate with this provider to really help them, to help them feel supported so that they then feel that they can keep that family member living at home.
And that's covered by the dual demonstration?
That would be covered by, as a neighborhood member, that would be, if you qualify and are selected for that program, that would be part of what you get as a health plan member, yes.
Longer term, was this just an experiment for Rhode Island, or is this a program that's going to be in place for the foreseeable future?
Well, it is called a demonstration,
yes,
which implies that it's an experiment, but I often remind people that when Medicaid managed care in Rhode Island started in 1994, it was also called a demonstration. And here we are 25 years later.
Right.
So we're hopeful that with the support of the administration, of the Trump administration and future administrations, that this would be a program that is sustainable.
All right. Dr. Alison Croke, thank you so much for your time today.
Thank you.
Appreciate it. And I'm Mabel Jong. Thanks for watching. Stay tuned.